Hello. It is my pleasure to introduce Dr. Julie Braungart-Rieker. She is a professor of psychology here at University of Notre Dame and is also the director of the Center for Children and Families. Her work focuses on the social and emotional development during infancy and early childhood. In particular, she's interested in the development of children's abilities to regulate and manage emotions. Using longitudinal designs, she examines the extent to which children's characteristics, parenting practices, the spousal relationship, and the father's role in the family relate to outcomes such as children's ability to manage distress, parent-child attachment security, and children's social competence. In his second line of work, Dr. Braungart-Rieker focuses on the family processes that may relate to the onset of early childhood obesity. So welcome.
Okay, so how do we switch slides? Oh, here we go, sorry. Thank you. So let me just start by talking a little bit about what I refer to as emotion regulation. These would be the processes involved in the changes in emotional dynamics. And sometimes we can think about this as upregulation, where we're trying to maybe increase our energy, our positive feelings, or downregulate, where we often talk about reducing distress and feeling upset. And usually we're referring to the intensity of an emotion. So we can look at, upregulation would be the example of, let's say, the gentleman in the top just learned that his roommate took his car without asking. He actually may try to maximize his expression of anger to convey how upset he is. So we still can see examples of maybe upregulating the expression of emotions when people are trying to convey information. But we can also talk about regulating the occurrence of the emotion, how frequently you see it, how long particular emotions might last. And we often think about, you can think about this as sort of, we can control sometimes, our expression of emotions. But oftentimes I think, especially if we're talking about infants in particular, these can be very automatic processes. But actually even young children do have some control. So when they're aware that perhaps it's inappropriate to laugh at someone else's expenses, they may try to downregulate the expression of positive feelings. Or, not sure exactly what this poor child is feeling, but she has probably been told to look happy. And she actually, she actually looks a lot like the woman on top, sort of in the middle, of semi-frightening and confused about the situation. But with infants, we think a lot of this is obviously much more automatic. So just to throw out a couple of related concepts, and people can have all sorts of, we talked last night about you can have entire conferences on certain issues. But, oh boy. Okay, we can think about the word coping. A lot of people will use that. So maybe this woman, had just experienced a breakup, so her friends are asking, how are you coping with the situation? That's, again, what we think about in terms of emotion regulation. Sometimes people talk about mood regulation, and moods are considered to be longer than emotions. So you've had a bad day, it's been really stressful, and how do you deal with that? Well, maybe I go running on the beach, which wouldn't be around here. Or perhaps I go to Legends and have a drink, which is right around the corner. And these may not always be adaptive responses, but they work, right? We can numb our pain. We can hopefully change our mood if that's what our goal is. And then in the psychoanalytic tradition, we can think about defensive strategies as also regulating emotions. So, if you're in denial, you're not even aware that you have a problem. So you feel fine, at least temporarily. So all these kinds of concepts is really what I'm getting at in terms of emotion regulation. And why is it important? Well, we know it's important when we see a problem and you see dysregulation. So if you look at clinical disorders in children and adolescents, these are just some of them. they're all different in terms of how they're expressed, but the commonality among them is that these are maladaptive attempts to regulate unwanted emotions. So, eating disorders, for example, can reflect that the child or adolescent is trying to numb some of their pain by engaging in binging and purging or other sorts of behaviors. But we can also look at it differently from a non-clinical perspective and look at the prediction of what happens if a child is, let's say, quote, a good regulator and is able to handle their feelings. So, or vice versa, if regulation is not high. And there's been some research, I was involved with this study, where we looked at regulation behaviors in infants, and this predicted what we can call behavioral regulation by the time they're toddlers. So children have a harder time regulating emotions as infants, also have a harder time dealing with impulse control and things like that, and I'll say more about that in a little bit. Okay, so I do want to acknowledge we've had a lot of talks on regulation, and which this conference just, I think, is really fun. I focus mostly on the behavioral expressions of regulation, and I'll show you those in a minute. But I want to acknowledge there are many, many, many different processes involved in regulating emotions and feelings. So neurobiological processes, hormonal, physiological, we talked about polyvagal theory last night, cognitive processes, so as children get older, we can reappraise a situation, and sometimes that can give us some perspective and make us maybe feel a little bit better. So what I'd like to really go over today would be first of all, what does emotion regulation even look like behaviorally during infancy? Do these, quote, regulatory behaviors actually regulate? Do they actually serve to decrease negative affect? Why do we see differences in children? Why do some children have the ability to really show lots of regulatory behaviors and fare well later, whereas others don't? I'll look at links between emotion regulation and attachment, with also behavioral regulation, sort of controlling your impulses. And then also looking at links with behavioral regulation and weight health or obesity in preschool children. Okay, so you see these behaviors a lot with infants. So sometimes we see infants sucking their thumbs, rubbing their faces, wringing their hands. Those would be examples of self-comforting behaviors. We can also see infants visually reorient their gaze. So that kind of serves multiple purposes. One is that we think that can help them disengage from something that's stressful, so it kind of gives them a break. And it also signals, if the caregiver is the one causing the stress, can signal to the caregiver that, whoa, slow down, you're overstimulating me. As children get older and have more motor control, we can see avoidance behaviors. And then, of course, when, again, infants need to be a little bit older, but they can start showing help-seeking or signaling behaviors that will hopefully attract a caregiver to help them regulate. Okay, so these would be sort of very typical kinds of behaviors that we see during infancy. Okay, so I know you've already seen 2 videos of the still face paradigm, but and I don't need to really go over what that procedure is since you saw that last night. But in case you weren't here, it's a 3-episode procedure where in the second episode, after the parent has been interacting with the child, the parent's told to shut down and pose a still face. The reason why we really like to use the still face paradigm is that we can really, in that still face episode, look at those regulatory behaviors. So what is that child doing during that episode when the parent is no longer available? And then during the play and the reunion episodes, we can look at what's the parent doing? How are they interacting? How sensitive is their behavior toward the child? So this is a 5-month-old. Okay, and how do I, oh, there we go.
Did you hear that? Did you hear that? Did you hear that? That's a doorbell. That's a doorbell. Yes, it's so loud. Ding dong. Ding dong. Ding dong. Ding dong. Yeah. 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 Peekaboo. Peekaboo, I see you.
So this is a very typical
Peekaboo.
interaction. The mother's making slight corrections along the way.
Here I am. Here I am. Yes. Where's mommy? Here I am. Yay. Peekaboo, I see you. Peekaboo, I see you.
Okay, so that's pretty amazing. But keep watching his behaviors, what he tries to do.
What is that? What is that? You spitting again?
Okay. So what did you see him do? What was that?
Disconnect.
He disconnected, right? And how did you see that?
His face turned away, loss of eye contact.
Right, exactly. And when he did that, did you notice what happened with his affect? Right? I mean, he was pretty upset right away, sort of this immediate reaction that, whoa, what are you doing? It helped him regulate, not perfectly, right? 5-month-olds should not be able to regulate themselves perfectly, but it really did, he has this skill to be able to handle some of this stress that he's experiencing. Okay, so I wanted to show this next one, I'm just going to show you part of it, particularly the still face part, in part because we have dads doing this, and I think we were one of the first labs to ask dads to do the still face, and one of our first questions was, do babies respond in the same way with fathers as they do with mothers? And the answer is yes. Now, this baby has a very different reaction to the still face, so it's just interesting to see how he handles this. He's 7 months, by the way. So, you know, different kind of reaction. He wasn't as stressed out as the first baby, but it's like if you could read his mind, he's saying, I know you're supposed to be playing with me, look how cute I am. And a lot of parent-focused regulation, or parent-focused attention anyway. And that's also sort of an interesting response to this, and I'll cycle back to that in a minute here. Okay. Okay, so one of the first questions we can ask is, do these behaviors actually regulate? And we coded on a second-by-second basis when the infants were 3, 5, and 7 months with both parents, counterbalancing the order of which parent went first. Self-comforting, distraction, that parent-focused attention like you really saw in the second baby. And also high-intensity motor. You might have noticed in the first baby, a lot of kicking and that sort of thing. And we looked at subsequent immediate changes in negative affect intensity after they would show any of these behaviors. And what we found was that, yes, that self-comforting and visual distraction helped downregulate the infant's negative affect. Parent-focused regulation, there was not a relationship with that, probably because there's, I think, 2 different reasons why infants are looking at the parent's face during still face. One is that they're either trying to really re-engage the parent, and they may not be too upset, or that sometimes these infants actually are so stuck and can't disengage that this makes them upset. So we kind of have contrasting effects there. And then high-intensity motor movements seem to serve as more upregulating negative affect, at least in this situation. And we found this to be very robust across age and also regardless of which parent the infant was interacting with. So another question we ask is, okay, great, so those are regulatory behaviors. What are some of the things that relate to individual differences in those behaviors? Some infants really don't regulate too well, and some do. So one thing that we started with was looking at temperament, which I'm sure you are aware these are sort of biologically based behaviors in part, not always. But sort of we talk about some kids as being fussier than others, and that's maybe just part of their temperament. And this was a study looking just at 4-month-olds and just during the still face episode. And we found that infants rated higher in negative temperament, at least with the mothers, we didn't find this with the fathers, showed less self-comforting, less visual distraction. Okay? So that's interesting and descriptive in a descriptive sense. I think it leads us with some questions, though, about direction of effects. So is it that temperament drives emotional regulatory behaviors, or is it that if you're a good regulator, you look like you have a less negative temperament? And I think Mary Rothbart would say more along the lines that really regulation is part of temperament, but it's not the whole thing. It's reactivity and regulation, which are actually somewhat independent of each other. So we can capture a little bit of that looking at temperament. But I think it's important to still acknowledge the role that some of these things may be somewhat biologically generated in terms of individual differences. Okay, so what about, though, the environment? And I won't spend a lot of time defining sensitivity. I think most of you are aware of what that means. But if you think about what not to do, if your child is crying, you should not be sitting on the couch with your friend, sipping a glass of wine, and saying something like, oh, she just wants attention and needs help. Not sensitive. That would be sort of an unresponsive reaction. We can also see intrusive behaviors, and this happens just to be a dad. We see these in moms, too. Oh, gosh.
Come on, I want you to laugh. Come on, son, laugh. Look at Daddy. Look at Daddy. Come on, Smiley butt. Come on, Julie butt. Laugh for Daddy. Come on. Gotta laugh for Daddy instead of sitting there drooling. Daddy can get you laughing. Come on. Come on. What are you still doing? Look up. Like that. Look at Daddy. How you doing? Come on.
Okay. So that's a little uncomfortable to watch, right? So what makes that insensitive is not that the father is tickling the child. That can be perfectly fine. It's a dyadic construct. So in relation to the infant's responses, who's sending all sorts of signals like, stop, the father is continuing to do that behavior. So that would be an example of an intrusive behavior. And what we find is that in statistical models where we statistically control for infant temperament, we found in our longitudinal study of 3 to 7-month-old babies that if parents were more sensitive, that over time we see greater increases in infants' positive affect with them. And we also see greater increases in positive affect and self-comforting behaviors as they recover from the still face to the reunion episode. So sensitive parenting is really facilitating the emotion regulatory process. We also see, if you collapse across age and episode, that there's greater visual orientation toward parents when the parents are more sensitive. Okay, so as I'm sure you all know, sensitivity and attachment have been strongly linked with each other. And a quote by John Bowlby that, attachment is the lasting psychological connectedness between human beings, and it's, one of the, if not the most important aspect of development. And lots of studies have established the link between parent sensitivity and secure attachment. But what's going on? Why are some infants developing these secure attachments and some are developing insecure attachments? And we think it's through these internal working models that infants are forming during the second phase of attachment, which is attachment in the making. Okay, so these are the representations that help infants anticipate, interpret, and guide their interactions. These don't just develop based on 1 or 2 interactions. These take a while for infants to form. So our reasoning actually behind why we studied infants at 3, 5, and 7 months is that we're capturing them prior to attachment formation. We're capturing them while they're forming, hopefully, these internal working models. So we suspected that we might see evidence during the still phase paradigm in this phase of possible forecasting of what happens to the attachment once it is more fully developed by 1 year of age. So this is just a recast of what I already talked about, how concurrently sensitivity and those emotion regulatory behaviors and affect behaviors are related. We also replicated the link between sensitivity at 3, 5, 7 months and attachment at 12 and 14 months. And then we really wanted to look more at the infant behaviors. Does this also, logically it should, right, predict attachment? And what we found is somewhat differences between mothers and fathers, but this is all the comparisons I'm going to show you are between secure infants versus insecure. And there's differences in the subtypes of insecurity, so it gets a little bit complicated, but infants who end up developing an ambivalent attachment, those C babies, had shown during the still phase less positive affect over time, so not this increasing trajectory, and it showed more self-comforting over time during reunion. Now you may be saying, wait a minute, I thought self-comforting was good. I think you need to pay attention to the context, so we wouldn't expect infants to show so much self-comforting during the reunion episode, right? We would expect that probably during the still phase, but when the parent has returned, we would expect the parent to be doing more of the job of the regulating and getting the baby back to a more neutral or positive state. And that's not the case for infants that develop this ambivalent style. Infants that develop a disorganized style throughout the still phase paradigm showed less parent orientation towards parents, which tells us something about their internal working model. And then with fathers, what we found was sort of interesting is that the only real sort of significant result we found was that those babies that develop a disorganized attachment look a lot like the ones that develop an ambivalent attachment with mothers. Again, more self-comforting, particularly during the reunion episode when the father has come back to try to help soothe the infant. Okay, so very interesting, I think, that we can capture these developing internal working models pretty early on. I wanted to bring up this study. This is out of Megan Gunner's lab. And what's interesting, it's a little bit hard to read that, but this is comparing secure infants who are in the black bar with, insecure infants are in the black bar and secure are gray. And this was what happens when children at 15 months are put in a new child care facility. What she measured here was cortisol, so this is getting at sort of their levels of stress. And what's interesting is that, so this is cortisol levels in the home. This was during an adaptation phase when mothers were allowed to stay with a child during the newly introduced child care. This was once the mothers have left and the child's there for a few days, not for 24 hours. They measured it at day 1, day 5, and day 9, I think. And then 5 months later. To me, what's interesting is right here. The mother is present, yet the cortisol levels have gone up in those infants who are insecure in their attachment. So the mother's presence is not comforting at a time of stress. And when we would expect stress to go up, right, they don't look different from infants who are secure. But their levels of stress are so high, it's as high as if mother's not there. So very, very telling. Okay, so this is sort of not a great segue, but I wanted to talk about more outcomes of emotion regulation. And so I was glad that EA was talking a lot about childhood obesity right prior. That it makes me wish we had asked a breastfeeding question. But as you all know, obesity rates are very high, and right now, roughly 1 in 5 preschoolers, so these are kids 2 to 5 years of age, are overweight or obese. And when you look at children at risk, so this can be low-income children, certain minority groups, the rate is even higher. It's 1 in 3. And the concern is that there's some evidence out there that once children become obese, they have an 80% chance of remaining obese as adults. So if we keep looking at those graphs of the numbers going up in childhood obesity, it's pretty scary to think about what happens as they develop. Colleagues of mine and I developed what we call the Family Lifestyles Project. This was actually a pilot study in the sense that we only have 40 mothers and children, not a pilot in the sense that we collected a lot of data, which I'll just talk about a little bit of it. But we were targeting these high-risk children for obesity, and these were kids who were actually attending Head Start and their mothers. And we saw 2 graphs of this last night, but we can think about how obesity or weight health there we go, is sort of at the center, and that we have, the child is embedded in, of course, multiple layers of systems, right? So their own behaviors can clearly be affecting why we see obesity, right? They may be eating unhealthy foods, they can be playing too many video games, not exercising a lot. I'm going to say more about impulsiveness and self-regulation in a minute, but all these things could be factoring in. But the child's not alone, they're not sitting in a vacuum, right? They're embedded in a family system, and we can look at a lot of things like the mother's own psychological well-being, food availability, her knowledge of nutrition, her own behaviors. And the family, of course, is embedded in a community system. And so things like if you're experiencing economic hardship, this is posing all sorts of financial stress and emotional stress on the family system. Neighborhood safety has been shown to be a factor in why some children don't play outside. So all these things, I mean, childhood obesity is, in my mind, is one of the most complicated things to think about. Yet, most treatment programs right now are looking at just the child, or perhaps the child and the mother, but keeping a very narrow focus on what, just have your child eat more healthy. And there's a lot of emotion that goes around eating and why we eat and those sorts of things. So we did not, of course, we couldn't measure all of those factors, but we tried to do is capture some of those different layers in this pilot study. And when we think about regulation during early childhood, a lot of us think about behavioral regulation, effortful control, impulse control. I'm meaning all the same things by those terms, where the definition might be, where we inhibit a dominant response. So I really want to do this, right? That's my dominant response, but I can't. And I maybe have to perform a subdominant response, which might just be I need to sit there, or maybe I need to go do something else. And I think that behavioral regulation is a very complex variable in and of itself. I think it contains an element of emotion regulation. If you have desire for something, that's a very motivating energy that you have. But it's also, in children, you have to think about motor control. So sometimes they do stuff and they don't want to do it, but they're doing it anyway. Attentional control, are they able to remember what the rule was? Can they stay focused on what they're supposed to be doing? So these are important to consider, particularly in preschoolers. And we did a couple of tasks. These are standard effortful control tasks. I just wanted to show you the snack delay, but actually our measure of behavioral regulation is a combination of all these different kinds of tasks where children are asked, like for example in tower task, take turns with the experimenter on building a tower. Don't look at the gift that the experimenter is wrapping in this really loud way, all these kinds of things. So I'll just show you the snack delay just so you can, it's like we talked about the marshmallow test last night. This is a very quick test. Children were taught what the rule was. In this case, we used either M&Ms or Skittles. And they were told to not eat the candy until the experimenter rang the bell. Okay, so I'm just going to show you the part where they now already know what the rules are. They practice the rules several times. Okay, why is this not? There we go.
You get both. Ready? Okay, put the glass over it.
I'm gonna eat it like no mama.
You can eat them, but not until I ring the bell. Remember? Okay. I'm gonna go check on something and I'll be right back. Don't eat them until I get back with the bell. Right? I'll be right back.
Okay, you can't even get the stopwatch started for that one. Okay, so that would be an example of low control. All right, I'll show you one more.
You can do two.
After this game, we're gonna do all of them.
Oh, you want to do all of them? Okay, so we're gonna start right now. Okay. I need to go check on something in the other room.
I ring the bell.
I don't know if you heard what she said. She said, I'm going to ring the bell. She really wants to ring that bell. Okay.
Oh, look at that.
Okay, she did it. But you can see it. It's so hard to control that desire that she has. So this is a lot to look at right here, but there we go. So our measure of child impulsivity is made up of the combination of tasks that I mentioned and also the mother's ratings of hyperactivity and attention problems. So high scores are more impulsive. And what we're looking at is this more ecological systems approach, that this is a key mediator. If you take this mediator out, or if you take negative parenting out of your models, the models fall apart. So what this is showing us is that children who are more impulsive are rated higher by their mothers on something called food approach, which gets at emotional overeating, high responsiveness to food, and this has been shown to be, where lots of studies have shown that link right here, that it's highly related to child BMI, as opposed to children who are fussy eaters, not motivated by food. They tend to have lower BMIs. But impulsivity is a key predictor in food approach. And as many developmental psychologists know, child impulsivity is predicted by, a lot of times what's going on in the parenting environment. So interestingly, our factor of parenting reflects actually high permissiveness and high authoritarianism, which we think is showing an inconsistent style of parenting. Sometimes I give in, and sometimes I overreact. And in turn, this is predicted by maternal depressive symptoms and demographic risk. So I think, we're very excited about this. Of course, one of the downsides of this is we just collected all this in one time point. So we can't say a whole lot about cascading effects or cause or things like that. But there's certainly this is correlational evidence that impulsivity is a very key factor here. We're just started. This is preliminary, so don't cite any of this yet. But we're looking at a large longitudinal data set, thanks to Dr. John Borkowski at our center. And this is a longitudinal study looking at children prenatally, well, looking at the mothers prenatally, and all the way up through age 3. And they targeted, 2 of the groups were considered high risk, so teen mothers, adult low-educated mothers, and adult high-educated mothers. And what we found is that we basically replicated our pilot data. So if you look at depressive symptoms prenatally, this predicts, in this case we called it positive parenting, and this was during infancy. So this would be, positive parenting would be sensitivity, responsiveness, and these were done in the home. So depressive symptoms prenatally predict lower positive parenting in infancy. Both depressive symptoms and parenting predict greater child impulsivity during the toddler period. We didn't have a food approach measure, but it does directly predict by age 3 children's BMI, even after controlling for birth weight. So again, this impulsivity is key, and what I think what all this data is telling us is that if we're going to develop interventions for, behavioral interventions with children who are at risk for obesity, we really have to target the parent-child dyad. And it may start with mothers prenatally. I mean, we talk about breastfeeding as being, a biologically important preventive strategy for a high BMI. But we may also need to really focus on parenting, dealing with risk, and those sorts of things early on. So just to wrap up, really what I think we're trying to say here is that self-comforting and visual distraction early on in life serve as down-regulators of negative affect during infancy. And that both temperament but parenting are very important, and not just maternal sensitivity, but paternal sensitivity as well, in terms of predicting emotion regulation. And that these early affective or regulatory responses during that phase of attachment in the making maybe really could inform us better about families or children at risk for developing insecure or disorganized attachments. And behavioral regulation is something to consider. One of the first slides I showed you is that early emotional regulatory behaviors also predict behavioral regulation. So there's, again, this sort of cascading effect of things that can happen. And behavioral regulation appears to be a key mediator, not just of childhood obesity, but behavioral problems and other social competence and things like that, school performance, you name it. And it's something that we can work on. We can work on with parents and children. Okay, so these all have implications, I would say, for prevention and intervention. We're right now trying to develop an intervention, or I should say a prevention program that would help mothers at risk with some of these kinds of issues, but we have a lot of work to do in that area. So, thank you. Any questions?
I actually have a question about the marshmallow test because I'd never been able to ask anyone about them. But one of the things that I wondered, and I'm sure you take this into account, so I just want to know kind of how we think about this, is for kids, there was some critique even like 20 years ago about standardized tests and the way questions were asked, and that kids from different cultural contexts would interpret, eggs falling on the ground differently than kids, say, with more money, that kind of thing. For kids who might be low SES or kind of have food insecurity issues, how does that take into account with something like the marshmallow test? And then the other kind of other confounding thing I thought about was issues of authority and who you listen to, and whether the random researcher who's doing the study, who this kid might know from 4 or so sessions but isn't in their life.
Right.
You know, because clearly some kids are handling it well, like that little girl, but, you know, some kids don't.
Great questions. Yes, I mean, that's our rationale for not just looking at like a snack delay, a food delay, because you're right. If you experience limited food availability, you'd be very smart to go ahead and eat food that's readily available to you. We also ask the mother for her ratings of the child too. So, sometimes kids don't act in the lab the way they would act at home, but we found that factor was pretty robust. The mother's ratings and our ratings were correlated. They seem to reflect something together. Each has a little bit of error to it. Some people complain about parent report because it may not be completely objective. Actually, when mothers are depressed, they tend to rate their children more poorly. But that's why we try to use multiple methods, because they do have limitations.
Just to comment on the ecological obesity perspective chart that you used. I know it's another source, but it seemed to me to leave out the driver of the whole system, which is the capitalist industrial food production matrix, system, which is also making use of the entertainment system. And so there's a whole food complex driving, getting into the homes through television and other media sources that would be the next largest level of that.
Yeah, that's a great point. One of my colleagues, Betsy Moore, who's on here, is in the marketing department here, and she's been very interested in sort of the role of advertising, how store displays are even set up, and who they target. And there's been some research that shows, if you look at television commercials, local commercials, that if we're talking about an African American community, there's actually a higher rate of fast food commercials targeted towards different areas, depending on the configuration of that geographic area. So it's scary to think about all the influences that are happening kind of simultaneously. And this is why that's why I was saying it's such a complicated system. And you're right, though, I left out some of those other real macro level variables that would be important to consider if we can. Thank you.
Hi. I'm quite interested that you're looking to studying parenting more. And I'm wondering about the impulse control, whether you know of anybody who's studied adult impulse control and parent impulse control and how that is a factor.
That is a great question. I've been thinking about that. There are some. It's very, very limited research as far as I know. But if you think about what goes on with parenting, right, there's a lot of planning. And how am I going to handle a situation? How might I prevent a situation from even happening? And then a lot of just self-control of your own emotions. I'm really mad at my kid right now, and how do I cope with that? Part of our intervention that we're thinking about is something we're calling Covert Parenting, which gets at helping moms think about how do they want their meals to go. What goes into the meal? What's the portion size look like? Not just facts, right? Not just you should have half a cup of this and half a cup of that, but how should the behavior be at the mealtime, and to have those thoughts in your head. But I think it may end up being actually a moderator of how successful some of these interventions might be. I think if some of the mothers have real difficulties with impulse control themselves or executive functioning, then I think it's more challenging to help them make changes as well. It's a family-wide issue. It's not just really about the child. So it's important to consider. Thank you.
Hi.
Hi.
I'm wondering if you've looked at trauma and temperament and controlled for that at all.
We did not. I think both of those things are important. Now, sometimes people will consider impulsivity like a temperament variable, and I would disagree with that. Mm-hmm. But there can be an element of temperament in there if we think, well, temperament and emotion regulation are kind of related. So it gets to me a little bit trickier to think about that as kids get older. to separate temperament from maybe more environmental causes of behavior. There's been some research with infants, though, that show that more difficult infants have a risk for more rapid weight gain, maybe in part because parents sometimes use food to soothe, put the bottle in the mouth, usually, or give the child something to eat. So that's an interesting thing to consider. And then what was the second thing you mentioned besides temperament?
Well, trauma.
Trauma, right. So yes, I think there's been some work in that area, maybe not so much looking at the child, but looking at adults who have experienced lots of trauma, and they are at greater risk for health problems across the board. We saw some graphs last night about that, but it would be I think, very interesting to look at how that trickles down to the child.
Right. And I'm wondering how, if a child has had trauma, how that impacts the temperament that the parents are perceiving, even if it's a birth trauma or something. So just in the research, I see this in my families that I work with, so I was just curious if it had been
Very
looked at.
interesting. No, that's a great idea.
Okay, thank you.
Thank you.
Hi, another question about parenting and emotional regulation. Did you collect data about parental disciplinary practices? In specific, there's some evidence that more punitive parents will have children with less emotion regulation and control.
Sure. Not in our studies with infants, but in the preschool set we did. And the factor that we were sort of surprised, this was all parent report, it's not observational, but the factor of negative parenting that we had is actually a combination of permissiveness and harsh authoritarian parenting. And I think we decided we should call it inconsistent parenting, because I think when parents are at their wits' end, they sometimes give up after they've tried to be pretty demanding about a situation, or even vice versa. So we did collect self-report data on that, and I think that's part of our thinking. So I talked about covert parenting. The other piece of our intervention that we're thinking about is overt parenting. And how do you handle temper tantrums in the grocery store? Or how do you handle whining behavior about, I want to eat only the chocolate, or whatever. Or just other behaviors too, not even food related. Because I think that adds to the stress of the family. When the parenting is not going well, the whole family climate is much more stressful.
I think you just answered my question.
Okay, great. Anyone else? Okay, thank you very much.